Hi, welcome. Life Therapeutic Massage, Jason Barlow. This evening, I'm going to present to you a little bit more about continuing from the head into this middle section of the spine. Now, this is quite an important area to bear in mind from the point of view of this connecting to the rib cage. Now, we've talked in the past about breathing, so every time we're breathing in and out through the neck muscles means the chest also is having to expand and contract. Now, with that in mind, there should be some natural movement occurring in this section of the spine. However, commonly, we're spending most of our day at the computer and in the vehicle with our spine rounded forward. So on Buddy right here, head's coming forward, that middle section of the spine tends to round, opening up all these channels, which remember, inside of this is the spinal cord. So we want to be able to get our spine back into an upright posture anytime we've been spending time in a forward posture. So there's two exercises I'm going to show you today which are going to help to do this for you. And important to bear in mind too, that when it comes to that middle section of your spine, it will also affect your range of motion at your shoulders. So if your spine is very commonly forward like this, if you were to raise your arms overhead, you probably find this might be your range of motion. Now, if that is you, you definitely want to be doing these exercises I'm going to teach you today. It's going to vastly improve your shoulder range of motion, decrease any pain in your back, and vastly improve your overall posture. So shoulder range of motion is highly influenced by middle back. As soon as I go from that forward position into an extended position, see what happens with my arms. I'm not actually moving my arms, I'm just moving my middle section of my spine, the thoracic spine. So here we go, exercise number one. This is one of my favorite ones I like to do on a daily basis. The arms are up against the wall. You could use any surface really that gives you that height. You place the hands flat. Your feet are probably about 1.5 feet away from the wall. From here then, I'm going to breathe in and lift my chest, and my head's just looking towards the wall right now. I'm holding my breath, and as I release after about 5 seconds, I release my breath. My knees are slightly bent, so I've not got locked knees, they're slightly bent. I lift the chest, I lean in towards the wall. One more time, breathing in as I go. Breathing out as I release. So how many times do you want to do that? I usually go for 10 repetitions and hold for a minimum of 5 to 10 seconds per repetition. And then I would do that as often as you can throughout the day. If you're spending several hours every day in this posture at work, you want to be spending several hours every day doing the opposite. Now that's not practical, so at the bare minimum I recommend to my patients morning, lunchtime, and in the evening. And if you can do more than 10 repetitions and it feels good to you, then do more, by all means. So let me show you a second exercise. Now the only tool that you're going to need for this would be what we call a foam roller. This guy here is about a 4-inch. Very commonly we're seeing 6-inch foam rollers. Either or will work. The 4-inch just helps you to very specifically pinpoint, 1 to 2 vertebrae. The 6-inch, the larger foam roller, actually covers like 3, almost 4 vertebrae. So that's the difference between the two. You can still elicit a similar effect. If you don't have one of these, the other alternative is to use a large inflatable Swiss ball or fitness ball. You can somewhat get into the same position at least. It just doesn't isolate those specific bones. Here's what it looks like. We're going to lay on a flat surface. And ideally it wants to be a firm surface rather than your bed, because this foam roller wants to be able to push upwards against the middle section of your spine. So we lay this on the floor, and then we simply position in the middle of our back to begin with, and then arch over, and the arms almost in a crucifix posture out to the sides. And what you'll find as you do this activity is as you roll, so I'm moving slightly further down now, higher up into the spine in effect, you hold each one maybe 20 to 30 seconds, you'll come to a point where it just feels really, really good on the spine and rejuvenating. And if anything, if you have symptoms in the mid-back and you get into this position and it just feels like all that pain goes, That would be what I call the hot zone. I would spend more time in the hot zone than anywhere else. And you can continue to work up. I wouldn't go any higher than the shoulder blades. So the top of your shoulder blades would be the highest that I would recommend to go. There is no need to go pushing the foam roller into the cervical bones of the neck. So very much when we're on this foam roller, we're staying in the zone of the rib cage, top of the shoulder blade to about mid low back. Okay, again, we're avoiding this region of the low back and we're avoiding this region of the neck. We're staying in this section right here. It's usually about T4, 5, 6, right here that people feel the most rejuvenating. And what it's doing is it's pushing forward on these bones and encouraging them to what we call mobilize, get back into the normal alignment. So these are two beautiful exercises. Highly recommend anybody to do these, and especially those who have issues with their middle back. It'll greatly improve that mobility. So until next time, check out my website, www.lifemassage.ca. You can click on YouTube, you can follow us on Facebook. I'll be updating these videos week to week. If there's any questions that you have, send me an email, jason@lifemassage.ca. Otherwise, enjoy your day, folks.